So let's talk about hba1c falsely high hba1c or falsely low hba1c. What are the conditions where you see those things? And first of all, let's understand what is hba1c. Whenever we talk about hba1c, it's nothing but glycated hemoglobin. So what is glycated hemoglobin? It's nothing but rbc, in simple terms, rbc bound with glucose molecule. That is in simple terms. I'm very simplifying it. It is hba1c glycated hemoglobin. So this gives you an idea about glycemic control in a patient for past 3 months, right? The hba1c levels are normal, then the glycemic control is good, right? That is somewhat around 6.5, less than 6.5 is a normal hba1c level. Now let's understand where if the patient is diabetic and not no proper glycemic control, then the hba1c will be more than 6.5, right? That is the basic understanding about hba1c. Now let's understand about another topic over here. So this is the basic thing which is there here. That is, whenever there is a decrease in rbc, or there is breakdown of rbc, or whatever the situation there is where rbcs are broken down fastly, and that stimulates the bone marrow to synthesize more rbcs. Firstly, it synthesizes reticulocyte that further transforms into mature rbc in the blood, right? But when there is intense hemolysis, or intense this turnover is high, when there is a demand is high, then the bone marrow, to meet that demand, it increases the reticulocyte count further. Without maturing, only the reticulocyte enters into the blood. So that, the immature rbc or the reticulocyte cannot bind to the uh, glucose molecules, that cannot become into glycated hemoglobin. Only the mature rbcs can are eligible to bind to glucose forming glycated hemoglobin. The immature rbcs cannot form that. So let's see few conditions where that may happen. See, whenever there is hemolysis, blood loss, it can be both acute or chronic blood loss. This hemolysis can be associated with hypersplenism, because as a compensatory mechanism, the spleen tries to produce, like, involves in the hematopoiesis, in the synthesis of rbcs also along with bone marrow. So that's why, yeah, there will be hypersplenism. In these conditions, wherever there is more turnover, right, or more demand, in simple terms, which creates more demand, all these conditions creates more demand in the body. It stimulates, or these conditions stimulate the bone marrow, right? It stimulates the bone marrow to synthesize new rbcs, right? So these are the conditions. There are other conditions too, where, for example, in anemia in chronic disease, uh, like in chronic kidney disease, in ckd, there will be, like, in that condition there will be anemia seen. When you give as a treatment for that, when you give erythropoietin to them, what happens is that erythropoietin will stimulate the bone marrow. That erythropoietin will stimulate the bone marrow to produce more rbcs. We already, see, there's also a condition where this is creating a more pressure on the bone marrow, or more demand on the bone marrow to form new rbcs. That is further getting into our topic of this, more demand further, this reticulocyte directly entering into the blood, and further no time for the, no time for the rbc, no time for the rbc to bind to glycated hemoglobin. That is nothing but the immature. Normal rbc lifespan is 120 days, right? But this immature reticulocyte, this immature rbc for or the reticulocyte, the lifespan is less than 120 days. So because there is no enough time for the formation of glycated hemoglobin here. So all these conditions, there are other there are other situations also. Vitamin c and vitamin e, these are antioxidants, we know about them, right? These are antioxidants. These interfere, it is being said that these interfere in the glycation. So that is also one of the situations where there is no glycated hemoglobin formation. So in all these conditions, there is falsely low hba1c, right? Because of there is no glycated hemoglobin formation in these conditions, right? Because of the less lifespan of the reticulocyte, no time for the glucose to bind to it. Falsely low hba1c. Now let's see a few conditions where there will be falsely high hba1c. So simple. If you have understood till now, you can clearly, easily like understand. You can decipher it on your own only, right? We have seen there that increased turnover. We have seen here, right? Increased turnover, increased demand will cause, you know, the reticulocyte to come into the blood, further restricting the glycated hemoglobin formation. Now the opposite happens over here. What happens in this condition? The time, you know, the life or the lifespan of RBC increased. All the conditions which does this, right, which increases the lifespan of the RBC, all the conditions which increase lifespan of RBC will cause falsely. That is nothing. The basic logic is the for the glycated hemoglobin formation, uh, you're giving more time for the glycated hemoglobin formation over because of the lifespan of RBC is increased. What are those conditions? For example, iron deficiency anemia, vitamin B12, vitamin B12 deficiency, aplastic anemia. Why these conditions will cause? Why these conditions will increase the lifespan of RBC? What is the logic behind it? See, in all these conditions, there is low or slow formation of RBCs because, see, in iron deficiency anemia, we don't have iron, right, which is a very crucial component of hemoglobin formation, and vitamin B12, which is also responsible, is important component in RBC formation. And aplastic anemia, it's nothing but the bone marrow is aplastic and has no the stem cell, from point of stem cell itself, there is no synthesis happening over there too, though because of that there is slow formation of RBC. Because of this, there is more time, there is more time for this RBC and your glycation, like glucose molecule to bind. You're giving, because of the slow formation of RBC, the lifespan of our normal lifespan of RBC is 120 days. Now it will somewhat increase to more than 120 days. Now you're giving more time for this glycation process. So falsely there will be high hba1c in these conditions. So in brief, in summary, it's nothing but whenever there is high turnover, high demand, uh, bec- because of that, there are reticulocyte entering into the blood, further decreasing the lifespan and the time for this glycation process. In these conditions where there is slow formation of RBCs, wherever there is deficiency of these integral components of RBCs, when they are deficient, the formation of RBC will also be slow. So in that situation, the lifespan, there is, because of the slow formation, the lifespan also increases. Because of that, the glycation time, the process of time for the glycation is also increased. That's why there will be high glycation, further high, falsely high hba1c levels. So this is the gist of entirety of why and what is the reasoning behind these conditions and their associations with this. Thank you.